Hello and welcome to this on-demand event today. My name is John Sheik. I'm here from UniTasterDays and my job basically is to introduce our speaker and introduce the subject. The subject we're going to be looking at today is veterinary nursing, and I'm going to call it vet nursing from this day forward because it's a lot easier for me to say. And I'm really, really delighted to be joined today by Lynn O'Byrne, joining us from the Royal Veterinary College. So with these events, we look at why you might be interested in studying the subject, what to expect on it, application tips and careers, but you've tuned in to hear from our speaker, not from myself. So, Lynn, can I come to you first? Do you mind just telling us a little bit more about yourself?
Yeah, sure. I qualified an extremely long time ago. I qualified back in 1992. I was working at the time for in the charity sector, so for a charity practice, and I did that for several years before sort of moving around. I did quite a lot of locuming, so I lived in Scotland, Wales, here, there, and everywhere. But then I developed an interest in emergency and critical care. So since about the late 90s, I've predominantly worked in emergency and critical care, ending up sort of 15 years ago at the RVC, working in the emergency department there, so in the ER and the ICU, and specialising in that department for the last 15 years. Terrifying.
Well, right. I'm so keen to hear more about your experience of that, during this short chat today. So, right, first question I always ask is looking at why students might want to consider the subject. So, say a student's watching this, maybe directly or maybe with their school group, and they're interested in finding out more about studying vet nursing, but why might they want to consider it?
Well, I mean, it sounds like a very obvious thing to say, but you really do have to have a love of animals and a desire to work with them. You need a lot of patience with them. And if you're doing it half-heartedly, you're not going to get very much out of it. Most of the people who come to study both veterinary medicine and vet nursing, they're driving forces that they want to work with animals. Otherwise, they'd probably have gone into nursing or be a doctor. So there is that. But I think it's a lot more of a scientific subject than a lot of people think it is. Sometimes I think vet nursing can be perceived as a bit of a, fluffy bunny, cuddly around the edges type of thing. But actually, there's a lot of studying involved. It's very scientific. It's really interesting. And I can honestly say that in the last 30 years, 30 years, that there is not a single day when I haven't learned something new clinically, because things are always being developed, always being added to. So it is a constantly evolving discipline. And so, it keeps you interested. You're not going to get bored.
Fab. Right. You touched on something then, Lynn. I just wanted to kind of follow up on that. So you mentioned about, we're talking today about vet nursing, but there'll be some people that are listening to this that perhaps are interested in vet science, which is what you mentioned there as well. So do you mind just giving us a few of the differences between the two of them for students that are kind of.
Yeah, sure. I mean, I think they are quite different jobs. I think it's quite interesting. Oftentimes, especially like previously, I've said, "Oh, I'm a vet nurse." "Oh, are you training to be a vet?" No, I'm a vet nurse. That's what I do. You wouldn't go and ask a nurse if they were training to be a doctor. It's the same thing. There's a very sort of clear division between the two jobs. And I think veterinary medicine, firstly, it's a longer degree. It's 5 years. And ultimately, your main focus in your job, if you work in practice, is either going to be consulting and sort of seeing patients as they come in the door, or surgery. Now, obviously, you can specialize in different areas, but you're going to be, those are your kind of main focuses. Whereas with nursing, again, you can specialize into different disciplines, medicine, surgery, anesthesia, cardiology, whatever you want to do, but you're more focused on being with the patient, perhaps in the ward environment, but you also get to see the surgery, do minor surgery, you can do consults. I think there is maybe a broader variety of things that will fall under your purview, but at the same time, when you are in practice, even though we have a professional register and you have to abide by a code of conduct or you can be struck off, what we do, we're not allowed to diagnose, we're not allowed to prescribe, even though you might know absolutely what the problem is. You're legally not allowed to do it. The buck for that stops with the vet. And indeed, when you do minor surgery, it has to be under the direction of the vet. So they're kind of yeah, the buck stops with them a lot for what is going on within the practice, and you have to stay within your legal confines and work within those.
So right, so getting back onto vet, concentrating on vet nursing, for a student that say starts the vet nursing course, and you've touched on this a little bit in the last answer, thank you, and thanks for doing that. What can they expect if they join a university in year one on a vet nursing degree?
I think the first thing to make really clear is, if you're going to do this, you need to really want to do it. It is a full-on, really tough course because of the requirements for qualification. So if you were to go to university and do something more kind of, I suppose, academically based, perhaps a history degree or an English degree or something like that, you might only have like 5 to 10 hours contact time a week, so lecture time a week. With veterinary nursing, you're going to have significantly more, and the reason for that is that in order to qualify and in order to register at the end of your degree, you have to have completed 1,800 hours in practice, and therefore, we've got to fit in all the theory around that. So unfortunately, where a lot of university students will get several weeks off over the summer, I'm afraid there's not that. You get 2 or 3 weeks, and you get a couple of weeks at Easter, a couple of weeks at Christmas. But we always say there is no such thing as a lazy VN student, because it's a really, really full-on course with a lot of requirements. But at the same time, it's really varied and interesting, and you get to do the theory side. You get to go out into practice on placement to actually put that theory into practice and learn your clinical skills and your practical skills as well. So there's, from day one, it's very much focused on making you a practicing professional, not it's not all about the theory. You're out into practice, you're doing the job.
One question that I hear students asking quite a lot is in relation to university and becoming a vet nurse. So quite simply, do you need to go to university if you want to be a vet nurse?
You don't need to. I didn't. I left school at 16, so I didn't even have A levels. So I qualified via the diploma route, which is still available, where you work full time and then study around that. So you're fulfilling your hours in practice by working full time, and then you study like in your own time, which was great fun. But that obviously is still available. But I think the really nice thing is that if you do that and then you've got your diploma, that doesn't mean you can't do a degree in the future. You can use that as a access, to get on to top up degree courses. You can do the foundation, you can do a BSc top up, and then you can go on to postgraduate qualifications as well. So you can pick one route or another now, but it doesn't empty your options box for the future. There's lots of different routes that you can go, and as long as you have fulfilled the 1,800 hours in practice, you've completed your nursing progress log, which is all of your day one clinical skills that you have to be competent at when you qualify, and you've passed the sort of theory exams, there's different routes of achieving that. And then if you want to, you don't have to, you're then qualified and you can be registered. But if you want to, over the years, you can go on and do, sort of more and more, and just get higher qualifications in whatever area you would like, basically.
It's been fantastic listening to you talking about veterinary, and honestly, your passion is contagious. So I'm sure a lot of students that are listening to this are going to be thinking, you know what, this sounds wonderful. So
I think it is wonderful. I absolutely love it, and I bore quite easily. When I first left school, I worked in a bank, and I think I made it through about 13 months before I ran for it. I was just bored. So yeah, if it can keep my attention, it can probably keep most people's.
And so I look like right at the start when you said about the variation, that will appeal to so many, so many students, especially the way the world is now, and the times are changed to kind of my day when I was looking first for jobs and things, and variation and getting involved in new things. It's going to tick a lot of boxes. So say a student is super keen now, and perhaps was super keen, and now that you've reinforced the keenness afterwards, if they want to then apply to university, is there any kind of application tips or anything you could add to there for the students that want to go to uni, noting that you don't need to?
I think one thing that would be really useful is if you can get some work experience. It doesn't have to be massive, even just a week or two in a local practice. Some take work experience students and some don't. So, you might have to look around a bit. But if you can get some work experience, and I think that's important for two reasons. Firstly, it shows that you are keen, it shows that you are serious, but also it gives you a bit of insight into what that job actually is, to make sure it is what you think it is and it is what you want, before you start committing huge amounts of time, effort, and frankly money, you know, into something that actually then turns out not to be quite what you thought. So I think it's a really good idea to get that insight. If you can't get work experience in a veterinary practice, maybe think about kennels or catteries, something like that, just to, you know, get that experience of being around different animals and like I say, demonstrating that you are serious about doing it, basically.
Thank you. And then the final thing is to touch on careers, and you kind of right at the start to talk about kind of, you know, very briefly your journey up to this point, but what careers can a vet nursing degree lead to, and perhaps, you know, include some of your experience in there as well?
Well, I think the nice thing these days is you can pretty much write your own career path. I think the opportunities have, since I started, certainly have expanded massively and continue to do so. Lots of different sort of referral practices are springing up. So you can specialize, as I say, you can pick a discipline. I love emergency and critical care, but, you know, one of my really good friends is into anesthesia, another one's into surgery. So you can actually do additional qualifications in those areas and specialize. But you don't have to do that. You can work in first opinion practice, which allows you to have a real variety on a daily basis. So you might be involved in nurse consultations and in anaesthesia for surgery and in nursing, you know, like I say, in wards, doing, you know, physio, rehab, all of those kind of things. And, you know, if you're lucky, puppy parties, because that's obviously why we all signed up. You know, that's why you want to do it, really, isn't it, to play with puppies? But you know, so there is a real variety that you can do in first opinion. You can work in private, you can work in the charity sector, you can locum and go all around the country if you want to. They're crying out for locums at the moment. But outside of that, you can also, this is a really good qualification to travel on. They love it in Australia. I've got friend, and I've traveled on it certainly, and done fun things with baby elephants and stuff. But I mean, you know, there's friends of mine, one of my friends is currently a head nurse in a hospital in Sri Lanka. You know, another one's been out to Vietnam and worked with pangolins. There's lots of things that you can do and use it to travel. You can go into the army with it if that's your bag. Yeah, but there's lots of different ways that it can be utilized going forward. And I think as well, a lot of the skills that you learn, if you suddenly decide like, no, I'm totally over this, yeah, a lot of the skills are really transferable. You know, communication skills, prioritization of tasks, time management, these are really transferable skills. But you can stay within the sector, you can do practice management, you can become a head nurse. So there's a million ways you can use it, and you can really design your own career path once, you know, it's hard work, but it's totally worth the hard work. Once you've got that qualification, you really can sort of decide how you want your career to go.
Lynn, thank you very much. And when you said about puppy parties, I think working with baby elephants top trumps, I reckon, the puppy parties. But
well, I have to say the baby elephants is fun. If you've ever bottle fed a baby elephant, it's insane. But you know, the puppy parties are just, oh, it's better than therapy. Totally better than therapy.
Lynn, thank you. So the final thing for me to do is just say a big thank you to you. So joining us today was Lynn O'Byrne, joining us from Royal Veterinary College in London. Is in London, isn't it, Lynn?
We have two campuses. One is out in Hertfordshire, sort of down by Pod Spa, and one is in Camden.
Close enough. Thank you. Big thanks, Lynn. And I really appreciate your time. This has been so handy.
No, you're welcome. It's been really nice talking to you.